coming. It's May 21st, 2019, 10 a.m., and it's the regular meeting of the Webster County Board of Supervisors. We're going to call this meeting to order. Please join me with a pledge of allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Item number 3 is to approve today's agenda.
Seconded.
I have a motion and a second. Questions or comments on today's agenda? Hearing none, all in favor? Opposed? Item 3 carries. Item 4 is to approve the previous meeting minutes.
Mr. Chairman, I'll move item 4.
I'll second it.
Motion and a second. Questions or comments on item number 4? Hearing none, all in favor? Opposed? Item 4 carries. Item number 5 is drainage claims. We have several. Drainage District number 29, Elkhorn Township, Section 36. The west bank of the ditch has slid in about 200 feet of the North Drive culverts, turned in by Brent Larson. Drainage District number 219, Roland Township, Section 21. We have a repair of the county main, turned in by Kim Anderson. Drainage District number 219, Jackson Township, Section 26, with a broken tile by Mark Lynch. Drainage District number 375, Pleasant Valley, Section 9, and they would like the camera tile lines camera. Drainage District number 69, Branch 9, Fulton Township, Section 8. We have a broken tile with a sinkhole turned in by Bruce Walrock.
Make the motion to act on item number 5. Second.
We have a motion and a second on item number 5. Do you have any questions or comments?
The camera, is that the one that we're already discussing out for the Hamilton?
No, I believe this is along Nelson Avenue.
Which one was that? The one on Branch then?
Yes.
Fulton? Yeah, that's the one Fulton. Yeah, the others, by Moreland, North of Moreland, something like that.
Somebody wanted their tile camera.
Yeah, to determine if there's a blockage, I'm sure, or if there's broken tile, that's what they're looking for.
All in favor?
Aye.
Opposed? The motion carries. Item number 6 is to accept and authorize the hiring and employment of Allison Roderick, Clerk, Auditor's Office, full-time, effective May 22nd, 2019, at the rate of $13.87 per hour, per recommendation of Doreen Kleiner, County Auditor.
Mr. Chairman, I motion to move item 6.
Second.
Motion and a second. Questions or comments?
Very excited to have Allison on board. Get my office back up to full staff again.
Thank you. All in favor?
Aye.
Opposed? Item 6 carries. Item 7 is to remove from the table and accept and authorize the hiring of Mackenzie Conrad, Service Coordinator, full-time, effective May 22nd, 2019, at the rate of $18 per hour, per recommendation of Allison Hauser, Director, Webster County Social Services.
I know we had tabled this in the past. Bob, did you want to speak on this a little bit?
Bob Lincoln, CEO for County Social Services. We're requesting this position to fill an existing or a vacated position by Sarah. I'm very excited to have her on board with your approval. I would just note that this is an expansion. We've added an additional coordinator to the West Quadrant as we try to fill some identified gaps in our provider network, if you will. So the West Quadrant has one more coordinator than the North and the East, just for your information. And then I have additional numbers and information to share with you. It's your pleasure.
All right. Thank you.
Mr. Chairman, I'll move item 7.
I'll second it.
We have a motion and a second. Any questions or comments on item number 7?
This is a replacement, correct?
Yes, this one is.
All in favor?
Aye.
Opposed? The motion carries. Thank you. And then we'll have you probably at the end.
I did.
Thank you very much.
Very good.
Thank you, Bob.
Item number 8 is to accept and authorize the hiring of Justin Kester, park attendant, seasonal temporary, effective May 23rd, 2019, at an hourly rate of pay of $11 per hour per recommendation of Matt Cosgrove, Conservation Director.
Make a motion to act on number 8.
Second.
Motion and a second. Questions or comments on item number 8? Hearing none, all in favor?
Aye.
Opposed? Item 8 carries. Item number 9 is to receive and place on file a 6-month pay increase to $22.13 per hour for James Murray, Class C equipment operator, effective May 19, 2019, per the recommendation of Randy Will, Webster County Engineer.
Mr. Chairman, I motion to move item
Second that.
Motion and a second on item number 9. Any questions or comments?
9.
Just regarding James Murray and then Dave Sierra and item number 10, I'm very satisfied with their work performance, and I want to let you know that.
Thank you.
Thanks, Brandy.
All in favor?
Aye.
Opposed? Item 9 carries. Item number 10 is to receive and place on file the 6-month pay increase to $21.48 per hour for David Sierra, Class A operator, effective April 17, 2019, per recommendation of Randy Will, Webster County Engineer.
Mr. Chairman, I'll move item 10.
I'll second it.
Motion and a second on item number 10. Any questions or comments? Hearing none, all in favor?
Aye.
Opposed? The motion carries. Item number 11 is to remove from the table and approve the final bargaining unit agreement between Webster County and Teamsters Local 238 Deputy Sheriffs, and authorize the chairman to sign agreements. Copy on file in the Human Resource Office.
I'll make the motion to act on item 11.
Second.
We have a motion and a second. Questions or comments on item number 11?
Last week I asked to have it tabled so that our HR could look over, and he's had that opportunity, so I'm fine with it going through it this time.
Any other questions or comments? All in favor?
Aye.
Opposed? The motion carries. Item number 12 is to remove from the table and approve the final bargaining unit agreement between Webster County and Teamsters Local 238 Jailers Unit, and authorize the chairman to sign the agreement. Copy on file in the Human Resource Office.
Mr. Chairman, I motion to move item 12.
Motion and a second on item number 12. Any questions or comments? Hearing none, all in favor?
Aye.
Opposed? The motion carries. Item number 13 is to remove from the table and approve the final bargaining unit agreement between Webster County and Teamsters Local 238 Courthouse Unit, and authorize the chairman to sign the agreement. A copy on file in the Human Resource Office.
Mr. Chairman, I'll move item 13.
I'll second it.
We have a motion and a second. Questions or comments? All in favor?
Aye.
Opposed? Item 13 carries. Item 14 is to remove from the table and approve the final bargaining unit agreement between Webster County and the Public, Professional, and Maintenance Employees, Local 2003, Secondary Roads, and authorize chairman to sign the agreement. Copy on file in the Human Resource Office.
Make a motion to act on item number 14.
Second.
Motion and a second for item number 14. Questions or comments? Hearing none, all in favor?
Aye.
Aye.
Opposed? Item 14 carries. Item 15 is to receive and place on file the Webster County's audit and financial reports for a period ending June 30th, 2018. Copy on file in the auditor's office.
Mr. Chairman, I motion to move item 15.
I second.
We have a motion and a second.
Great audit, looked like we did a good job, gained a little bit on our ending fund balances, so very happy with where things turned out.
Excellent. Thank you very much for all your hard work. All in favor?
Aye.
Opposed? Item 15 carries. Item number 16 is a public hearing on the proposed amendment to the current county budget for fiscal year 2018 and 2019. It is 10:10. Do you have any written
I do, well, I have no written comments.
All right.
We're gonna,
Questions or comments from the floor? From the table?
I'll quickly go over
Okay.
basically what this is for. Basically, in the sheriff's office, we have an increase of 36,000, and it's basically for inmates, additional inmates and more costs related to that. Drainage, we have a project, a mapping project that's gonna be an online GIS project, 25,000, and we're finishing that up, so that should be able to go online soon. District court, we have increased court costs with more trials. A couple of those trials are gonna be out of town, so we had to increase our budget to adjust for those. Medical examiner, unfortunately, there have been more accidents, type of deaths that had to go to the state auditor, so that has increased our costs by that $10,000 mark. Building and maintenance, we have a day porter increase, and then we had some utility increases that were not anticipated. Emergency services, which is basically the EMS system, the sirens, and our new tower that we put in place. That was an additional cost of $3,500. Administration, we had more publications this year, more issues that we've had to publicize for, changes in ordinances and such. And then also we had a new farm we purchased, and we have those taxes that had to be paid for. And then that was for $7,600. And then the final one was for TIF. We approved a Cargill agreement, and then we also had a payment for roads that were not anticipated for $322,110. So a total of $474,547. And on the sheriff's side, there was also a revenue of $34,190. Kind of an overview.
Thank you very much. Any other questions or comments for the public hearing on proposed amendments to the current county budget for fiscal year 2018-2019? We will close the public hearing. Item number 17 is to approve and authorize the chair to sign an amendment to the current county budget for fiscal year 2018-2019, and further to approve an increase in the following departments: sheriff's $36,000, drainage $25,000, district court $22,122, medical examiner $10,000, buildings $48,215, EMS sirens $3,500, administration $7,600, and tax increment financing $322,110.
Mr. Chairman, I'll move item 17.
I'll second it.
We have a motion and a second. Questions or comments? All in favor?
Aye.
Opposed? Item 17 carries. Item number 18 is a public hearing on proposed sale of county-owned parcels. Time is 10:13. We have two parcels.
Two parcels are both in the town of Dayton. One is right down next to the, kind of by the rodeo, and it's kind of in the middle of Landis. It's a small sliver inside of that. And then the other one is a wooded area that's next to a couple of homes. And so one of the owners had come in and requested that he wanted to purchase the ground from the county, so.
Okay. Questions or comments? We will close the hearing, 10:13. Item number 19 is to open bids for proposed sale of county-owned property in Dayton, Iowa.
I'll make a motion to act on item number 19. Second.
The first one is for the parcel down by the rodeo. It's the west 132 feet of block 15 and the adjacent 22 feet of the vacated road and Eden section addition to Dayton. And the bid is $1. It's on the correct form. The other one is for lots 5, 6, and 7 of block 6 of Keaton's second addition to Dayton. Property property number parcel 1914402-001. Turned in by Blake Hanson, hereby accept the conditions of the bid of $252.50 for the following property, 5, 6, and 7, and Block 6 of Eden Second Edition to date.
What was the dollar amount?
$252.50. So we have one bid for each property. Item number 20 is to consider a resolution number 2019-20, accepting a bid for sale for county-owned parcel number 1914434-001, the west 132 feet, block 15 and the adjacent 22 feet of vacated road, Eden's Second Edition to Dayton, Iowa.
Mr. Chairman, I motion we accept the high bid of $1.
Seconded.
We have a motion and a second. Questions or comments? All in favor? What's the roll call? I apologize.
Carlson, aye.
Campbell, aye.
Conrad, aye.
Vote aye.
Item 20 passes. Item number 21 is to consider the resolution number 2019-21, accepting the bid for sale of county-owned parcel number 1914402-001, Block 5, 6, and 7, and Block 6 of Eden's Second Edition, Dayton, Iowa.
Mr. Chairman, I motion that we accept the high bid of $252.50.
I'll second it.
Questions or comments? Roll call.
Carlson, aye.
Campbell, aye.
Conrad, aye.
Vote aye.
The motion passes. Item number 22 is to approve proposed First Amendment to the Fort Dodge Department Human Services Targeted Case Management lease.
I'll make the motion to act on item number 22.
Second.
Motion and a second. Questions or comments? Hearing none, all in favor?
Aye.
Opposed? Item 22 carries. Item 23 is to approve a special Class C liquor license for Celebration Inc., 2360 160th Street, Fort Dodge, Iowa.
Mr. Chairman, I motion we move item 23.
I'll second.
Motion and a second. Do you have all?
Yes, dram shops in place, they provided the permit and the site location, the site map, so we should get to go.
Thank you. Questions or comments on item number 23? All in favor?
Aye.
Aye.
Opposed? Item 23 carries. Item number 24 is to receive and place on file the annual manure management plan for Craig Katak, Homer Site, 2966 Stagecoach Road, Webster City.
Mr. Chairman, I'll move item 24.
I'll second it.
Motion and a second.
They made no changes.
And so we had the question this morning, this is a Webster City address, however, they do spread manure in Webster County, that is why we are receiving this and placing it on file. All in favor?
Aye.
Aye.
Opposed? The motion carries. Item number 25 is to receive and place on file the manure management plan for Jordan Thomas Finisher, 1938 270th Street, Fort Dodge.
Make the motion to move item number 25.
Second.
Motion and a second.
This is a new site.
It's a less than 2,400, 2,500 head, and therefore it's not required to do a master matrix on it.
All in favor?
Aye.
Opposed? The motion passes. Item 26 is to approve and authorize the chair to sign a permit from Webster Calhoun Cooperative Telephone Association to bury a fiber optic cable from 1261 210th Street to 1244 210th Street between sections 28 and 33, Township 89 North, Range 30 West of Johnson Township.
Mr. Chairman, I motion we move item 26.
Second.
Motion and a second. Questions or comments? All in favor?
Aye.
Aye.
Opposed? The motion carries. Item 27 is to approve and authorize Jacob Hagan from Bolton and Mink on behalf of Joint Drainage District number 8795 to hot roll and televise approximately 3,000 feet of an existing tile along Route D18 right-of-way between sections 13 and 14, Township 89 North, Range 27 West of Colfax Township.
Mr. Chairman, I'll move item 27.
I'll second.
Motion Dan, second. Questions or comments? Hearing none, all in favor?
Aye.
Opposed? Item 27 carries. It is now the citizens' opportunity to address the board with items not on the agenda. We do have a guest, Mr. Lincoln, if you'd like to share.
Thank you for the opportunity. I'd like to share some numbers with you. The first sheet I'll pass around is our financial position. I've shared this report with you in the past, and it's the report we've sifted down to one page to give the clearest snapshot to our stakeholders and our board, the financial position of county social services. So we produce this report monthly. If you see at the top left, we're through 83% of the year, and in the bottom right, you'll see our expenditures to date are at 78%. So we're running 5% under our re-estimated budget. Our original budget was $18 million. After we had 6 months of experience, we realized that we were well under our initial budget, and we adjusted our projection. What's significant about the re-estimate too is we re-estimated to be in line with our levy collection. So we've, over the last 4 to 5 years, County Social Services has invested the reserve dollars or fund balance dollars, if you'll recall. And then now we're at a place where we're maintaining, and actually now we're back to actually generating a bit of a surplus. The numbers I added to this report, because there's been a lot of conversation comparing our region to other regions and the marketplace, if you will. So again, I want to give a clearer picture to stakeholders where we are in relationship to per capita. And so if you look at those bottom left numbers, what we're doing for you is we're taking the last 3 months or the last quarter of expenditures, and we're projecting that forward a year. And if nothing changed from the last 3 months, then we would have expended, or we would expend $28.63 per capita. We're currently levying at $35 per capita, so that excess that we're levying is what's giving us the capacity going forward to meet those goals we've identified to you in the past. Here in Fort Dodge, the most significant investment we're looking at, of course, is the Access Center and some other service expansions. The other number is the actual year-to-date, taking into consideration the first 2 quarters at $31.74. So again, financially, we're very stable. What I also like is if you look at the prior month, which would be the month of March, you see total expenditures of $1.1 million, and then the current month, which is April, which is $1 million, and then what we've also been able to do is give you the actual claims that have been processed but not posted on the financial report of $1,053,000. And our finance and our operating team have done a great job of doing the best they can to make sure all providers are paid each month, so the board has a clear picture of trend. So we're not bunching claims, paying a bunch this month, not paying none next month. So again, you can see we're quite consistent going forward. We also have the ending cash balance, the $7.5 million is how much money we have in our collective account, how much money we have available to pay our claims going forward till our next tax collection. What we've done with our member counties, Fund 10, is we've tried to get them down to 3 months of operating reserve, so that, again, we have most of our money setting and available in the collective account. Any questions or comments about that? Okay, so then to reflect what did you get for those dollars, we've generated our first draft of our quadrant service report. And I emphasize the first draft. Generating reports is a lot. There's all kinds of numbers. There's all kinds of information. But what we're trying to do here is trying to build, again, like we did with the financial snapshot, is a dashboard of the services that are being delivered. So this is going to be a work in process. But I think it really, the main message it's delivering is there is a fairly equitable distribution of services and resources across the region. I think that's, of course, one of the main concerns, again, that our many members and stakeholders have. So just to kind of give you the context of the report, is for actual services and individuals served from January 1st through March 30th. So that's the most comprehensive, clean data, if you will. Obviously, there'll still be claims coming in that will be that will go back and post to this report. But I think it certainly gives us enough information to inform us. What I'm reporting here is the number of units of services provided, and then you'll also see the relationship of the services to the financial report. So if you want to know what each of those services are costing on average, you can take the line for treatment, 422, and you can divide it by our expenditures for that quarter to get the average cost of that service. I don't know how much detail you want, so I'll kind of leave that to questions. But again, structurally, core services are our current mandated services. Those are the things that the state has mandated the regions to provide. The mandated services, there we're talking about mostly court action, mental health advocate, civil commitments, attorneys. When we get into the additional core services, those are the services that we've leaned forward with. Those are the investments we've made, filling the gaps in the services that we believe that our community needed. And we were validated by that with House File 2456, which now next year, or within the next 2 years, will move most of those additional core services up to core services. And so now it won't be an option for regions, it will be a mandate. And again, that's a way to look at CSS in relationship to the other regions. We've gone beyond the mandates. We've anticipated the expansion. We've used our reserve dollars to invest and build out a service system in anticipation of the needs of the state and our communities. Other services, again, these are not mandated services, and I can get into more detail, and as we move forward and as people reflect on this report and they want to see more specific things, we can certainly generate that. Another fact that's built into this report is if you take the region total and you subtract east, north, south, and west, it won't balance. There's a fair number of folks that we serve that at the time of reporting are not residents of the region. Again, we're serving in many cases a very transient population. We can serve people for a long term in a residential setting. They can be discharged to another region, and suddenly they're no longer counted as a resident of our community. And again, that was one of the fundamental reasons for creating the regions, because before regions county spent a lot of time in the parlor game of saying who's ours and who's not. And that was the whole concept of legal settlement that generated a lot of legal action and a lot of complexity to the system. The regions have dispelled with that. So now we don't worry about where you're from. If you're here, you're ours, and we're gonna see that your needs are met. But that will explain why adding those numbers across don't always add up. The other note you can see at the bottom, if you look at under other services, community living supports, we have 11,000 units in the east. So that's a tweak in the report we're going to have to work on because we're counting miles of transportation. And we do a lot of miles of transportation in the east, but it's really not reflective of the level of services that we're providing there in comparison to the other quadrants. The other note of the quadrants is one of the fundamental objectives of reorganizing to form the quadrants is to make an assessment. Are we building up the capacity of these service hubs? The service hubs are much more important than the region. And so when we look at this quadrant, we know that Fort Dodge and Webster is a service hub for this quadrant. We know in the south that Blackhawk is a hub for that quadrant. In the east, Decorah, and in the north, Mason City or Cerro Gordo. But if you look at population, so again, making the correlation of how we're delivering services based on population, the populations of the east, north, and west quadrant are very similar. They're within maybe 10,000 of each other, right around 90,000. If you look at the south quadrant, it's almost exactly twice the population as the other three. So again, as we look at distribution, we're looking at 1/5, 1/5, 1/5, and 2/5. So again, to give you some context of whether those numbers make sense or not. A number that we did tease out was the RCF number. Residential care facilities is long-term support services. It's a service, if that setting is over 16 beds, it doesn't qualify for Medicaid reimbursement. But it's a service that our hospitals and our communities rely on because those beds are available, and it provides for a very effective transitional support for folks, but it's also one of our largest cost drivers. So we've been very conscious of our use of residential care facilities. If you go back a year and a half, we were serving nearly 220 people in county-funded residential care facilities. Now we're down to 68. And that's attributed to the very significant financial swing we've made, reducing year-to-date almost $8 million. Those folks are still being served, but through our quadrant teams, they've been transitioned into their benefits, what their Medicaid or the MCOs will pay. And that continues to be the focus of most of our quadrant teams, is how do we maximize our citizens' benefits. Because again, it's easy for us to pay for it. It's harder for us to get the MCOs to pay and for them to get enrolled in the appropriate program. The other thing I would lift up is if you look at the service coordination line under other services, that's mostly that line item and the justice involved services. Those units are mostly delivered by our team. Those are services that we provide versus purchasing those services. So then, if you look at those numbers, we're really quite equitable across the region. We have a smaller group of service coordinators in the south region, and again, that's because we have a higher concentration of providers. We don't have to do as much of the services, whereas we get into our more rural quadrants, which are the other three, we're delivering more direct service. And again, that's a very intentional focus of our agency. The numbers in the west, I think, are down again because we've had some turnover. I anticipate that number as we get fully staffed will increase or come in line with the other quadrants. In terms of actual services provided, again, we've got a total there for you, and again, I still feel that's a little skewed by the 11,000, so we'll tighten that up. The bottom line is how many people we've served in the East Quadrant. These are unduplicated counts, so a lot of these folks may have gotten several services or one service, but they did receive something in this quarter. 319 in the East, 484 in the North, 901 in the South, and 318 in the West, for a total unduplicated count of 2,146. Individuals that have been served by county social services but not counted because they weren't enrolled are seen on the information and referral line. And so what we have our team do, if somebody walks in the office and needs help with an application or needs help getting reconnected with their MCO, those are the direct service hours staff we're spending on helping those folks, but not taking applications, not enrolling them for services, but providing a very valuable service to the community. I don't want to go on beyond. I don't want you to stop listening before I stop talking.
No. You're doing great. This is wonderful information. Are you able to explain what units are for each of these? Because it differs. Like you said, down below, community living support, those are miles. What's a unit of like treatment or crisis response or?
Yeah. So again, it just depends primarily now because we're pulling this out of our claims data, so it's how we're paying. And that will give us an opportunity to tweak and tighten and build out those assumptions. But if we just take treatment, for example, we paid on a episode of treatment. So that was med management, that was outpatient therapy, something of that nature. If we get to crisis, stabilization, residential services, those are billed daily. So those are billed out at about $360. So again, those are smaller numbers but much bigger dollars. And I'm really pleased to see the level of crisis stabilizations being provided in the West. We know that there's a huge need for more beds in this community. Places where people can go to be stabilized, get a treatment, so they're not being shipped to Council Bluffs or Davenport. And so that remains one of our primary drivers. Subacute services, we had our first appearance of subacute services because our crisis center in Waterloo just opened our first subacute unit, and so they're paving the way so we can figure out how to ramp up and develop that service in Fort Dodge, which I think will meet the need that I was talking about. So yeah, as we work this report, we're gonna whack down that 11,000 because we know that doesn't inform us how many months. So we're gonna figure out how we can convert in our process. But this was between 20 and 30 hours of work because there's no buttons that generate this. We drop raw data and we sort and we sort and we sort. So there's actual data behind all these numbers, but to your point, we certainly want to continue to add things to this report that have value. One area we've been discussing a lot is if you look at this from a service delivery standpoint, what we're really identifying here is process. We're identifying service process that we're doing that we're providing to help folks. What we're not measuring is what are the outcomes, and that's what gets really ambiguous in the work that we do. The four primary outcomes we're trying to track and want to figure out a better way to get this on the report is how many people are finding jobs, how many people are finding housing, how many people are reconnecting with their community, truly engaged in recovery. And the fourth is what we call somatic care. How many people are truly connecting with their healthcare provider, are actually improving their health and well-being.
Questions? Thank you very much. Appreciate it.
Appreciate you.
Any other questions or comments from the community? Board of Supervisor Committee reports.
Upper Des Moines tonight and Emmitsburg, and Thursday Public Health.
I'm gonna go visit Bob tomorrow in Clayton County for CSS. Also have Midas tomorrow. Last week I had the Greater Fort Dodge Growth Alliance Executive Committee, which went very well. And I wanted to thank the team here at the courthouse for helping with the 5th and 6th grade graders tour last week. That went very well as well.
Nothing this week, however, we did have the CFR ribbon cutting last week, and it was very successful, so.
We have mental health tomorrow. We'll also be meeting with the Growth Alliance for a workshop tomorrow on rail development. Last week, I want to thank our legislators for coming and talking to us about mental health. And we have a couple drainage meetings coming up that people have spoke to us. If you are out and see a broken tile or some damage in your drainage ditches, please get that in immediately so we can get somebody out there. That's all I got. Motion to adjourn.
Seconded.
All in favor?
Aye.
We are adjourned.